Hello, this is Dr. Do again. This video is still on alphabetic list problems, still on letter T. Today I'm going to talk about the thyroid nodule. There's so many other conditions like a TIA or the trauma or anything. I just hold it to the coming videos. But today I'm going to talk about the thyroid nodule. I had previously talked about the hyper or hypothyroidism. Not necessarily all the nodules have these conditions, or not necessarily all the hyper or hypothyroidism has the nodules. So they are different. Of course, they can exchange. For example, sometimes the nodule could be the hyperthyroidism, or sometimes the hypothyroidism could be also associated with the nodule. Depends. So basically, today I'm going to talk about the thyroid nodule. Usually, that is the something grows on your neck. Okay, let me just bring up to the emergency situation associated with this thyroid nodule. First of all, anything you need to see your physician right away. The sooner the better. It could be life-threatening. Yes, there is. If the cyst, for example, is too big, or there bleeding in the thyroid gland cause this massive bleeding, usually that's not quite common, but if it happens, really can block the trachea, narrow the trachea, impair the breathing. If that's the case, that's really is the emergency. This is because the thyroid is just the organ across the trachea on the neck at the center. So if the swelling is big enough, cause the breathing difficulty, or you feel shortness breathing or choking, do not hesitate. Go see your physician. The sooner the better. Probably, I think in particularly last decades, a couple of decades ago, a lot of patients carry this big growth in the neck without symptoms, just carry that. So they did not seek the medical, otherwise, did not seek medical attention until one day it just blocked the trachea, caused the respiratory difficulty or stress. So that's definitely the emergency situation. Or there's some type of nodule can associate with this hyperthyroidism, which has the crisis of thyroid crisis, which is also life-threatening because of the huge amount of thyroid released in the blood, causing this hypermetabolic conditions, such as like a high blood pressure, high heart rate, and flushing, and that's blood pressure can raise really high. So if that's the case, that's also the emergency. So this is about the nodule, the emergency situation. Can you manage at home? I'm not saying you're managing at home. You just live with it sometimes. Like I said, particularly in a couple of decades ago, a remote area, they carry this nodule without symptoms. They do not know because the symptoms is there, but sometimes it's subtle. So then no medical otherwise, no medical management, they just live like that. It's not managed. They did not do anything, just carry it. So that's if that's the case, really it's not good in long run. So if you feel something on your neck, on your thyroid, I think it's better to check it out. Could be minor, just cyst, and then just take it out, or could it be serious, some other severe conditions. So anyway, so this is about the thyroid nodule. What are you, as a patient, if you have something grow, what the signs really, you think, I have to see physician anyway, you have to see physician anyway. But if the nodule is really hard, or like if you touch it, it's kind of really hard, almost like a bone. Because thyroid is very soft, it's an endocrine gland. But if you have nodule, there is like a fibrosis, so it's very hard. And particularly if it's not regular, no shape, no border, that's definitely it's a sign. You see your physician. Sometimes doesn't mean all the hard nodules means bad. Sometimes the fibroma, it also could occur, but usually in thyroid it's not the case. So regardless, either it's soft or hard, or small or big, see your physician. That's the first remind, the first purpose for this video. So after you see your physician, what they will do, usually start from the ultrasound to scan, to test the nature of this nodule. Is it solid or is it cyst? So the ultrasound from the echo resonance can tell whether this is solid or there's some cyst inside. And after that, and then there's some other, of course, the thyroid function test, whether this nodule affect your hormone level, T3, T4, TSH, and then manage accordingly. But usually if the nodule is there, and if is the diagnosis suspect, the physician not sure what is going on, they probably do the fine needle aspiration to, particularly when they suspect it might be the malignant. So they do the aspiration to check the cells. But sometimes if they suspect, they just do the surgery, remove the nodule for once and all, and then do the pathology. It depends on individual, but the physicians, they have guidelines to follow how to approach this thyroid nodule based on the nodule itself, clinical symptoms, whether there's associated with hyper or hypothyroidism, or they will do the nuclear scan to see whether this nodule is hot or cold. In medical terms, still hot nodule, cold nodule, which means if it is hot, which means increased thyroid hormone, cause the hypothyroidism. If it's cold, it's probably just there's no thyroid hormone produced in that nodule. Usually it means quite bad, actually, of a cold nodule. I think physicians also, especially surgeons, they are not afraid of hot nodule. They're afraid of cold nodule on the patient, because cold nodule means there's no radioactive material uptake to the thyroid, which means those cells are not functional. So that's kind of worse compared to the hot nodule. But regardless, none of them is good. So anyway, this is about the thyroid nodule. What are the causes? It could be just a simple cyst, could be just adenoma, or could be malignant, or could be just hypertrophic. So these are all the causes for this nodule. And regardless if you have symptoms of it or have no symptoms, pain or not painful, see the physician, and the physician will test probably, or particularly for this nodule associated with the symptoms, either hypothyroidism, you feel you eat more, flushing, and feel heartbeat faster, and hungry all the time, increased metabolic capacity, increased metabolic rate. So if that's the case, definitely you need to see a physician. Or on the other hand, this nodule do not bring you these symptoms, but on the other hand, make you feel cold or whatever the symptoms cause hypothyroidism. Usually it's not quite common, but it could happen, particularly for this malignant. So this is about the thyroid nodule. It's separated from hypothyroidism because it is far. It could be either of them or could be none of them. So that's why I put here. And I hope it helps. But the take-home message is, if you feel something grows, it was not there before, something newly grow in your body anywhere, not just thyroid, you need to see your physician to get it checked to make sure it's not something really bad or serious, and to take care of at early time. So I'm going to stop here, and thank you for watching. I will see you next time.